Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment. Treatment is first, when do you treat? The treatment or indication of surgery. Obviously, we should do surgery. The indications of surgery are if there are patients has renal pain, severe renal pain, which is occurring in intermittently, and when there is increased hydronephrosis, because if there is increased hydronephrosis, it will compress the parenchyma of the kidney, and thus it causes pressure atrophy of the parenchyma of the kidney, which is not desirable. So whenever there is pressure atrophy of parenchyma of the kidney is completely gone. Only the a bag of fluid filled structure which is thin walled will be left, so that is not desirable. So whenever there is evidence of parenchymal damage, we should intervene and do the surgery to prevent the uh, atrophy of the renal tissue. So the main important aim of this surgery is to conserve the renal tissue. We need to prevent the pressure atrophy. Nephrectomy is done only when the parenchyma is largely destroyed, because in nephrectomy we could do nothing, we will have to remove the kidney. This is done when there is complete atrophy of the parenchyma, only then we do uh, nephrectomy. Nephrectomy is done only when renal parenchyma is largely destroyed. Then, but in milder cases, it is not important to do nephrectomy. Milder cases, first we should do serial ultrasound follow up. If there is milder cases, first and foremost you should follow up the case with serial ultrasound, and only then if you operate if there is dilatation is increasing. And if you compare the previous scan and the present scan, and if you find out that the dilatation is increasing, only then we treat the milder cases. But if it is so severe that the renal tissue is damaged, then we do nephrectomy. Then, in these patients, if there is acute urinary retention because of the block, if there is urinary retention is present, catheterization is done if there is acute urinary retention. Then, spontaneous void, if the catheterization is left for for some days, then spontaneous voiding may return. When the detrusor tone returns, the spontaneous voiding will return. But for the spontaneous voiding to return, the catheter should be left for 3 days. The catheter should be left for 3 days in the urinary system or renal system, and spontaneous voiding will return in most of the cases. But if it does not return, then we have pyloroplasty is present for the treatment. We can use Anderson-Hines pyloroplasty, can be done for um, Anderson-Hines pyloroplasty can be done for hydronephrosis.
thank you and thank you for watching.